Desire Bob Manuel is a trained accountant. He is also the special assistant to the governor of Rivers State on MDGs. He said his passion is to contribute to change, especially in the MDG sectors in rural communities. Desire is currently overseeing the overhaul of the healthcare infrastructure in Rivers State.
The Rivers State government is embarking on a complete overhaul of our healthcare infrastructure, not just infrastructure, the process that delivers health services to our people. At the heart of this is the reconstruction of our primary health centers. The state government is constructing more than 100 of them, and about 100 actually in service right now. And amongst these, government is furnishing and equipping about 66 of these primary health centers through the conditional grant scheme process. We are also procuring support materials like marine ambulances to help support the referral system between the primary health centers.
At one of the new health centers set up by the government, patients are receiving attention by a police officer. This is the Police Comprehensive Health Center. It is run 24 hours with residential quarters for doctors, nurses and midwives.
As the MDG office in Nigeria is concerned, we've partnered with them in the area of health. We've established quite a lot of health centers. Out of these health centers, few of them, I don't know if they're up to 20, I can't get the number now. I have to contact my office to get the number. Few of them have been equipped by the MDG office in Abuja. So they bring the funds, we do the due process which they approve, and then we get the contractors to supply us and they pay. I wouldn't just say they pay 100% because we also bring a matching grant to our own contribution to match with whatever they bring from Abuja, with which we now equip the health centers, and we equip quite a number of them. The next thing we have done with them is the purchase of mobile clinics. Ambulances, you may refer to them, or you may refer to them as mobile clinics, in the sense that they provide health. They're not land ambulances, they are sea-going ambulances. And so our coastal areas are served, even though there are also health centers, but if we have emergency cases for which we need to ferry somebody to the city to see another doctor, we will have to use those ambulances. And again, that we have partnered with MDG to purchase them. I think they are functioning now in Rivers State. These are the two areas we have partnered with them, and it's gone a long way to reduce the child maternal mortality rate in Rivers State.
Funds are being put to use in all teaching hospitals nationwide. The health sector has enjoyed special attention because 3 goals are tied to it: reducing child mortality, improving maternal health, and combating HIV/AIDS, malaria, and other diseases have seen the Health Ministry and the MDG's office working closely over the past 5 years. The Millennium Development Goals places emphasis on a number of interlinked and interrelated goals, and the Nigerian government, through the Office of the Senior Special Assistant to the President on MDGs, has targeted funds from debt relief gains at core MDG-related government ministries, departments, and agencies. Majority of funding for these establishments have been directed to providing health, education, water, and empowering the poor. Interventions are pouring in from international organizations, but more is needed.
As I speak, there is a training program that is being funded by Bill Clinton Foundation for people who are suffering from HIV and AIDS, pediatric HIV and AIDS, those who are taking care of them. That's the health workers who take care of them. They are being trained at this time, and that is being funded by Bill Clinton Foundation.
The conditional grant scheme process is just a minute component of our global strategy in Rivers State as a government towards achieving the MDGs. Hundreds of millions of dollars have been spent, which translates to tens of billions of naira, in revamping the education sector. His Excellency declared an education emergency, and hundreds of primary schools and tens of model secondary schools have been built to achieve that component of the MDG. In the health sector, tens, hundreds of hospitals are being completed. There are about 110 of these kinds of primary health centers completed and functioning in Rivers State already. It is hoped that every ward, by the primary healthcare development standard, every ward will have one of these.
We've done quite a lot in the area of education, in the area of health, employment generation. With the issue of infrastructure development, we have that and all that. But basically, I'm not looking at MDG as a measurement to determine what I do. I'm just trying to carry on to see what we can do to provide the basic necessities of life to our people.
The MDG's office is working with development partners to reduce poverty by promoting non-oil growth and more effective public spending by the government. Key government ministries, departments and agencies are in on the march for a national push to achieve the Millennium Development Goals. Meeting Goal 8 of the MDGs, which is to develop a global partnership for development, requires political, financial and service commitment by the Nigerian government at all levels, civil society, private sector and development partners.